good Wednesday morning to everyone. Thanks so much for joining us. I'm Mabel Jong, and you're watching WHCC TV, coming to you from Washington, D.C., and this is day 4 coverage of the World Healthcare Congress. We hope you've enjoyed the content. We've enjoyed producing it for you. And on our final day here, I'm so pleased to have with me Dr. Tom Scott, who's going to talk about a new degree that you can get in benefits design. Thank you so much for being with us, Dr. Scott.
Thanks for having me. I appreciate it.
Yeah, so this is a completely new thing that you're offering at the University of Lynchburg. It's a degree, a graduate degree in benefits design?
It's a graduate degree, master's degree in health benefits design and health informatics. Yep.
Wow, okay.
Yep.
How did that come about?
Well, over the last several years, I've spent a lot of time in healthcare and actually co-founded a company called Sonospine, which is a company that uses high-frequency ultrasonic surgical procedures to avoid spinal fusions. Through that whole process and getting the company going and understanding how things work in the healthcare system, there were some interesting things that arose. I mean, I thought this would be it's an $80,000 fusion that you're replacing with a $30,000 non-fusion, so there's no metal in the body, no screws, the patient doesn't have adjacent level disease in 5 years, and there's a better recovery. So I thought this would be really easy to get implemented. But it's the way the system is set up now, it's just difficult, because what hospital systems will hear is that's $30,000 instead of $80,000, and I don't have the plates and screws or an overnight stay, and I have to teach a neurosurgeon something new, which is a nightmare, so I didn't want to do that. So about a year ago, but the company's been up and successful, and it's now in DC and Scottsdale, Houston, and New York by the end of the year. But last year, it was 13 months ago, University of Lynchburg asked me to be a director of their health informatics management program. And as a result of the research that I did, so I talked to a lot of healthcare systems and consultants, and the feedback I got was, I'm kind of interested in informatics, but I'm more interested in the EMR system and the nursing shortage and getting a data warehouse together. But if you can write me a genetic algorithm that predicts the exact healthcare of those 5 people, then I'm really interested. And I said, well, I could do that, but Berkshire Hathaway's $300 million ahead of us on the investment. So when I came to the World Healthcare Congress last year, I got to meet Al Lewis and Dave Chase and Dave Contorno, and I got to see the John Mackey from Whole Foods talk about how the pieces of value-based healthcare were actually being brought together in designs. So knowing a little bit, I knew about direct primary care, I knew about centers of excellence and reference-based pricing, but until I saw John Mackey and the Rosen hotels present and show that these were all cohesively tied in a strong healthcare plan for a lot lower cost, I wasn't aware of that could be done. So at that point, at the end of the conference, I remember telling Dave Contorno, there might be enough here for a master's degree. And he said, if you know David, it's so hard to get him excited. Not. He said, if you're serious, I'm in. And after that, I talked to Tom Emmerich, Keith Smith, Bill Hennessy, a lot of big names in the industry, and dozens and dozens of benefits advisors and human resource directors, and came up with an online program that is designed to be extremely practical. I can't emphasize that enough. I think universities, when you think of that, you think maybe overpriced, theoretical, but you got to have it. Yeah. And this is kind of the opposite. So this is a 1-year online degree, 5-week courses that focus on the things that benefits advisors and human resource directors need to put together a plan without gaps, that enables better healthcare quality and a 30 to 50% reduction in cost.
Right, and part of the work does involve designing a plan from start to finish for a company.
Yes.
Okay.
So what I found also was the benefits advisors, the smart benefits advisors, Health Rosetta certified benefits advisors, felt pretty good about the elements, but they weren't really confident enough to tie it together in one place, and that's largely because after you leave a great conference like this, you hit the wall in the real world, and it's not the norm yet to go to self-insured. And so you lose momentum. So by having this program and having a forcing mechanism every 5 weeks to further what they're doing, it makes it practical. So as you said, in August this year, the benefits advisors are going to present a plan to the best minds in the industry for a self-insured plan
that they've designed.
That they've designed for a client.
Okay.
And if they're new to the field, we provide some data so they can do that.
Okay.
But you know, it's more than understanding how to put the design together. It's how do you address human resource concerns.
Right.
Because when you talk to a human resource director, the one thing I did not hear them say is, I can't wait for open enrollment. That is my favorite time of year. They just don't like that.
No, right.
So they have reasons for that. You know, it's hard to implement, so to train, educate, and engage patients in a new way, or employees in a new way of looking at healthcare. But honestly, the way we're doing it now, Mabel, I just did an analysis. If you're a breadwinner in a family of 4 and making $60,000 a year and have a $200,000 house, 30-year mortgage, 6% interest, after you pay for food, you have $130 left, and that's assuming you own a car.
There's nothing left over.
There's nothing. There's nothing.
How many students have signed up for the program so far?
Yeah. So right now there's because we didn't start this. We didn't have it approved until January. So 10 are in the first cohort, primarily benefits advisors. We have, it looks like about 10 or 15 coming on in May, and we're looking at 40 or 50 in September, so in August. So you can start the program in the winter, spring, or fall, and get through between 12 months and 14 months.
And these are folks who are already involved in healthcare?
To a large extent they are, but we're at an interesting time. So it's certainly for benefits advisors and benefits administrators, so human resource directors or CFOs. But the interesting time in healthcare is that if you're looking at healthcare from a value-based perspective, 20 years experience isn't that valuable anymore.
Sure,
if you're
things
doing
are changing so quickly.
They are. And so you could come in as a recent graduate, take one primer course, and jump into the program.
Are there plans to offer the primer course to introduce them to the bigger picture of the graduate course?
Exactly.
Okay.
Exactly, and that's this summer. This summer we have that. We have it every semester, but the first time we're offering that is this summer.
Do students in college now realize, or are they familiar with the healthcare landscape and the problems that are plaguing it?
Not at all.
Okay.
Not at all. In fact, most of the companies you talk with aren't really sure. I mean, if you ask a human resource person, how much do you spend per year per employee on healthcare, most of them don't know.
Right.
And that's part of the problem. So I think the education has to start. And the other piece, of course, when you're young, you don't go to the doctor that often. But I think what really needs to be understood for the millennials and that age group is that if we don't do something about it, you're going to spend 80% of your disposable income on healthcare. And I don't think they want that.
Right. So will there be a lot of effort made, in the primer course to really spell out what this healthcare picture looks like and educating and getting them interested in digging deeper? Absolutely.
Absolutely. I think what people think about when they think of education is it's, as I said, it's theoretical, and I don't want to do that, but this is real. So we're going to talk about the Commonwealth study in 2016, where the U.S. finished 11th in quality and cost compared to the 11 richest nations. We're going to talk about why can I get an MRI for $600 here and go across the street and get one for $2,400? Why is that?
It's the same test.
It's the same test. It's the same test. And why is it that 25% of the transactions when I pay for a drug, the copay costs more than the drug? The copay. Right. Why is that? So these are things that should be bothering a lot of people, and the problem is the complexity built around healthcare has kind of prevented that level of scrutiny before.
Okay.
So.
Tom, it's such a pleasure to talk with you about this.
It's been great to talk to you. Thank you.
Thank you.
Okay.
And thank you for watching. Stay tuned.
Okay.